Hi, everybody. John DeRossett here with Integrity Talk. I had a full list of topics lined up for today, but after looking at the headlines, I realized we needed to focus on just two of the most important issues happening right now, and that's SNAP benefits and healthcare premiums under the Affordable Care Act, or if you prefer, Obamacare. Stick around, we'll be right back. Okay, the first thing we're going to talk about today is the SNAP program. SNAP serves about 42 million Americans, and it's a critical safety net food aid program in the United States. Because of the ongoing federal shutdown that began on October 1st, SNAP is facing one of the most significant disruptions in history. Now, here's what happened, or here's what's going on. First of all, if you've been approved for October and you haven't received your your SNAP benefits yet, you'll still get them for October. That money's already been allocated. It's there. Now, as of November 1st, there is no more money. So, what's supposed to happen is there's a contingency fund for situations like this, but the Republicans will not release the money. Even Mike Johnson got on with, I think it was CBS News the other day, and he said this is a bargaining chip that we have, more or less, and we're not going to cave in. This will help the Democrats agree to our terms, and so on and so on. You know how mealy mouthed that fool is. Anyway, so from November 1st, there are no SNAP benefits. I checked as early as an hour ago, and there's still nothing going on with that. The USDA said they will not release any of the $6 billion that they have in the contingency fund. Now, 23 states have gotten together, their attorneys general, and they're suing the Trump administration. And two judges came down with an order that said these SNAP benefits will be paid out of the contingency fund. But we all know how Donald Trump, the great pumpkin, is. He needs the court to clarify exactly what they mean in their order, and then he'll distribute the funds. I don't know what needs to be clarified for him. The order was pretty straightforward. Anyway, the judge is going to look at it again on Monday and put the order in, something like that. And I gotta do some more research on that part of it, because it really didn't make any sense to me when that order came out, because it was like, on the one hand, she was saying distribute the funds, but on the other hand, it was like she was telling them they could take their time, more or less, or something. I don't know. I have to look into that a little bit deeper. But when the government shuts down, that means no money goes out. But there's contingency plans for just such a situation. So the funds are there. They won't release them. Mike Johnson admitted that they're using that to try to force the Democrats to agree to this budget proposal that they have, which actually screws up the entire healthcare system, which is the second part of this video. because in some cases people's premiums are going to go from like $150 a month to $1,500 a month. I don't have the exact figures on that part yet, but it's pretty serious. And that's why the Democrats are holding out on this continuing resolution budget, because it cuts out the subsidies for health care. And in other words, a lot of people are going to lose their health insurance. But we'll talk more about that in a little bit. But right now, here's what's at stake with this SNAP situation. Many low-income households, children, elderly people, disabled people, anybody really on a fixed income, as of today, there's no food benefit at all. So now here's what's going to happen. The money the funds that SNAP would have covered for their groceries is now going to have to come out of their cash. They're on a fixed income. In most cases, anything more than a $20 screw up in a month for somebody on a fixed income can be devastating. So if somebody's getting, let's just say, $200 a month in food stamps, and that's their food budget for the month. Well, now that money has to come out of their cash, and where they're going to get it? They can't replace it. Once SNAP does come in, you can't use that to pay your bills. That's for your food. Anyway, it's a really bad situation. Now, there are food banks all over the place, and that's a great program. But when you go there, generally speaking, you get about one bag of whatever they might have on hand, if they have anything on hand. That's another part of that issue. If they even have anything on hand, it's like one bag per person per week, in some cases per month, from any given agency. Now, in California, Gavin Newsom gave or allocated $80 million to the food banks so that they could stock up and getting ready for this. I thought he was going to work out a way to where everybody would get their SNAP benefits, but that's just out of reach for them, I guess. Excuse me. It's out of reach for them, I guess, because of the sheer amount of money involved. Now, in California, about 5.3 million people rely on SNAP as part of their food budget. Some of them, for some people, that's their entire food budget. So he gave $80 million to the food banks to help offset the shortfall. He warned at the same time that if the government shutdown persists and the funds weren't available by a certain date, that the SNAP benefits are going to be delayed, and they are. But here's the thing. Unless the courts do intervene, let's say the shutdown goes all the way up until December. Then November's gone. They're not going to retroactively give those SNAP benefits. So if the people lose November, it's just gone. Now you got to worry about December. So anyway, back to the food banks. So he gave us money to food banks. He's deploying the National Guard to help distribute the food to make things go faster, because he knows there are going to be long lines, at these food banks trying to get people some food into their houses. If you look at Maryland, about 680,000 people in Maryland are SNAP recipients. And the governor in Maryland, Wes Moore, declared a state of emergency, and he set aside $10 million to help the food banks to restock them so that they could help the people in their communities. But they didn't have the money, like California. They didn't have the money to commit to fully paying the SNAP benefits to the people. It's too much money. Now, Maryland opted not to use the state funds to fully backfill the shortfall, while some states did. But, each state, it depends on their situation and what budget they have, and it's just a lot involved. Now, I tried to find information for other states like West Virginia, but all that information is sketchy right now. But we're in a serious situation, folks, and the Republicans are holding your SNAP benefits hostage, is what it boils down to try to force the Democrats to agree to their terms on this continuing resolution for the budget, so they can get the government back open. But when they do, if the Democrats agree to this, then every person that has health insurance through ACA or Obamacare is going to see serious increases in their monthly premiums for health insurance. And those people in that position already know, or should already know, how much their premiums went up, because it's now the open enrollment period for the health insurance sector. So if anything changes as far as SNAP goes, I'll jump on and do a video and let everybody know. Like, share, subscribe, so you can stay up to date with the information. And we'll do the best that we can to get that information out to you as fast as possible. When we come back, we'll talk about Obamacare. All right, now let's talk about health care, which is probably the most important thing that's going on right now, even more so than SNAP. So right now, the Democrats and the Republicans are arguing over this continuing resolution budget. The Democrats won't give in, because if they do, that's when you're going to see your insurance premiums skyrocket. Now, here's where things stand. The ACA marketplace depends heavily on what's called premium tax credits. This is subsidies that reduce how much you pay each month for your health insurance. The problem is, many of the enhanced credits are scheduled to expire at the end of 2025. So after December, well, you've already seen it though. Everybody that's on this should have already gotten their open enrollment package. And it's going to show you what your premiums are now. On average, the prices are going to jump up 18 to 26%. But it depends on your plan, how many people you have on the plan. In some cases, it's going to go up 66%. I've seen examples where a man's premiums are going to go from $350 a month to $1,050 a month. So the subsidies that these tax credits provide help to offset the cost of this insurance. It's terrible insurance, there's no doubt about it, but it's better than nothing. And until the Great Pumpkin gets away from his concepts of a plan and actually puts something into place, this is the best we've got. And the Republicans are trying to take that away from you. So anyway, the average net premium for subsidized enrollees is projected to more than double. Insurance providers are already asking for increases of anywhere to from 18 to 26% for 2026 to begin with. So if your premium doubles or even triples, like I said in some cases, then they want as much as 26% more than that even for the year 2026. This is the insurance companies. Probably, aside from the Great Pumpkin, some of the biggest crooks in the world. Anyway, for some households, especially those who earn just above subsidy eligibility thresholds, the jump is going to be hundreds, and in some cases, like I said, thousands more every month. So consider this. Many ACA enrollees were paying small monthly premiums. Some people even paid zero because it depends on your income. Thanks to the enhanced credits, that took care of that for you. Now, what's going to happen? Imagine losing much of that subsidy overnight. A family of four with an income that's around 140% of the federal poverty level, who paid almost nothing for insurance this year, could see their premiums climb into the thousands of dollars a year. Now that's annually. But in short, it's not just a number on a page. It's real money leaving your house, already squeezed by inflation, housing costs, and stagnant wages. We all know what stagnant wages are, right? It means you're making the same thing you were 5 years ago, but everything keeps going up, 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 up. Now the constituents are pushing back. Polling shows widespread public support for extending those premium tax credits. In fact, about 78% of Americans, most of whom are in Republican-controlled states, and voted for the Great Pumpkin. Anyway, they're all saying that these tax credits need to be renewed. The Republican Party, however, says no. They made all these cuts to Medicare and Medicaid, and they want those cuts to stick. They're going to tell you, oh, the Democrats just want to keep them going so the illegal immigrants can have Medicaid. Illegal immigrants have never, ever been eligible for Medicaid. Ever. There are some cases of fraud, and that's across, but it's a low number, like less than 1%, I think, and that's across the United States. That's not any Republican or Democrat-controlled state. It's not anything like that. But in this world, I don't care where you're at and what program you have going, there's a certain amount of fraud attached to everything. Look at Donald Trump and his fraud. 34 count convicted felon. And he's going to hold back a little bit of SNAP money and a tax break so you can afford your health insurance. Give me a break. Now, this isn't just an abstract policy. People are worried and they're demanding action. They're telling, I don't know about the Republican people, other than what I see in the polls, but Democratic constituents are telling the House members, stand fast, don't give in. Because they know that when these insurance premiums jump, they're not going to have any insurance, or everything's just going to go wrong for them. Now, what the Democrats want to do is extend this until a better plan can be developed. It's a must-have. There's no two ways about it. People need health insurance. The Republicans, though, are taking the position that major new spending or subsidy extensions have to wait until full government funding is resolved. And in other words, the health insurance subsidy fight is being folded into a larger shutdown battle. So for many Americans, this is a dual threat. Not only are you losing your food stamp benefits, which the Republican Party is happy about, believe me, even though it's hurting their own constituents too. You see, these people don't care. They're billionaires. They're going to sit around, they're going to eat prime rib all day long, and eggs benefit, or whatever it is these fools eat. But they don't give a rat's ass whether you eat or not. They don't care. They don't care if you have health insurance. You've already seen they don't care about cancer research or anything like that, because they cut that. They're cutting everything, and it's all in the name of lining their own pockets with more money. Some of these people have money that won't all get spent for 10 generations, yet they want more. So anyway, what you need to watch for is enrollment for 2026 health insurance plans kicks off on November 1st. That's today. The new rates, new premiums, it all goes live. You're already seeing it. States are already beginning to estimate the fallout. For example, in California, a 66% rise in the premium is projected if the federal help disappears. The question is, will the Democratic side stand firm? So far they have. That's what we want them to do. Because at the end of the day, the Republicans already know they're going to have a hard time in the midterms. They're going to lose a lot of seats. And if they don't soon cave, they're going to lose even more seats. But the bottom line to the Democratic Party from the constituents is, don't give up our health care coverage to political brinkmanship. Don't let that mealy-mouthed Mike Johnson take health care away from the people. That's ultimately what they want to do. They want to get rid of these subsidies because that means even more money in the billionaires' pockets. Anyway, this is just all something to think about. That's all I've got for today, other than to remind you to tell all your friends during the midterms, if you want our country to get back to normal, vote Democrat. Democrat, 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 Democrat. Because while there are still normal Republicans out there, the reality is that MAGA is controlling everything right now. And we got to stop them. We got to stop them dead fast. Like, share, and subscribe, and I'll see you next time.